Welcome to Habitual Excellence, presented by Value Capture. This podcast and our firm is all about helping you and your organization achieve habitual excellence via one unifying focus, one value-based structure, and one performance system. In other words, it's about helping you capture dramatically more value through achieving perfect care and perfect safety for patients and staff. To learn more about Value Capture and our services, visit www.valuecapturellc.com.
Welcome, listeners, to another special episode of Habitual Excellence, the podcast where we bring the best doers and thinkers in healthcare and beyond for other leaders to learn from today and really through all time. And I'm particularly excited today because we've got two wonderful leaders on to learn with us, Katie Anderson and Gerald Harris. Katie, I'm sure most of our listeners will know her well already. She is an internationally recognized leadership, organizational learning, and performance coach. She is certainly a thought leader in how to make great organizations where performance endures. She is an author. She has a wonderful book, most recent book, Learning to Lead and Leading to Learn, that we'll probably hear a little bit of wisdom from today. She is a podcaster. Don't miss her Chain of Learning podcast, which is itself a timeless and timely resource. She's recently featured our very own Brad Toussaint on that podcast. So Katie, thank you for doing that. It's wonderful how our learning intermixes. And we also have Gerald Harris, and Gerald is a vice president of Value Capture. I'm Ken Siegel. I'm the CEO of Value Capture. I neglected to introduce myself for those that don't know. Gerald has a profound background in leading change, first in the auto industry at huge scale, and learned all of the lessons of what great leadership looks like and takes and requires, and how to coach others into doing it. And moved a long time ago into healthcare and is associated with many of the great demonstrations of how fast and how enduringly healthcare can improve with these ideas, and is a wonderful spirit and a wonderful teacher. So Gerald, thank you for being here as well.
Thank you, Ken.
And today with Katie and Gerald, we're going to do two special things. The first is we're going to dive into a topic that Katie has been exploring deeply and that resonates for a lot with us at Value Capture, and that is the concept of the serious leader. And we'll talk about why it's so important at this moment in the healthcare industry and beyond. But we're also going to talk about a very exciting opportunity to get together in person and go deeper into these ideas and practical learning strategies together at the 2024 Lean Solutions Summit coming up in September on the coast of Michigan. So both of our speakers are deeply involved in that, and we'll be getting to that at the back end of the podcast. So don't go anywhere. Great learning opportunity. But let's turn to the concept of serious leader. And Katie, you've been doing a lot of work to help us understand the concept, codify it, help leaders think deeply about how they can capitalize on the importance of this idea and framework. So can you just walk us into the concept of the serious leader, why you started to explore it so deeply, and what promise you think it holds for leaders who want to create great organizations today?
Great, Ken. Thank you so much. And for a little context before I jump into the serious leader, I want to share with the listeners that I actually come from a healthcare background, and Brad Toussaint was my first boss when I was getting into lean and continuous improvement and operational excellence in hospitals and healthcare systems. I have my master's of public health, and I am deeply passionate about how can we improve healthcare. And that was actually the genesis of my curiosity about how can we make great organizations, and then not just focusing on process, but really how do each of us as participants in the system and then as leaders within the system really create the conditions for learning and continuous improvement and excellence to flourish. I started my own company in 14 and then had this incredible opportunity to move to Japan for my husband's job. And this gets to the serious leader of how I got to know Toyota leader Isao Yoshino, who's the subject of my book, Learning to Lead, Leading to Learn. In my curiosity, when I was living in Japan and then subsequently, when I moved back to the United States and was working again with not just healthcare organizations, but biotech companies, manufacturing, global organizations as well, about how do leaders really create these cultures of operational excellence. And my question to Mr. Yoshino in the beginning was, what's the secret to Toyota? How become all these companies are and leaders trying to copy them? And he kept saying there is no secret, except maybe the only secret is their attitude towards learning. And we started to unpack that over years. And really what I've come to discover through conversations with him and working with leaders in organizations like large healthcare systems and government agencies is that leaders have to be truly serious about what it means for themselves to show up to create those conditions. It can't be just what everyone out there. And this was a question that was asked to Mr. Yoshino. Actually, when Brad and I talked about this on a recent Chain of Learning episode of my podcast, and he was there when Mr. Yoshino gave the answer. Someone asked, what is it really that leaders need to do? And he said, leaders need to be serious. They have to be truly committed, not just to the result, which they need to get, but the actions and behaviors that it takes to get the result. So of course we want the result, but we too often focus just on that outcome. But it's really, how are we showing up with 1000% commitment about what it takes to get there? And it's not just what it takes for everyone else, but ourselves. And so that requires us to examine like our own behaviors about how, what are we doing that is driving the conditions that will lead to the results that we want? And so this is what it means to be the serious leader. It's setting that clear direction for the organization, showing up to provide support to people, and making sure that we're developing ourselves as well. So I'll pause there because that's just the framework of what it means to be the serious leader. And there are so many examples of leaders, who are serious, including, at Alcoa and the genesis of value capture, but you have to really be dedicated and committed to that vision and how you're showing up to create that vision to become a reality.
Well, Katie, that's of course a brilliant framing, and you're teasing the stories of leaders and what it looks like when it's really happening. And I, before we get to those, and some profound thoughts from Gerald as well to frame us up, I was struck in that podcast with Mr. Yoshino how he started to flesh that out a bit and talked about one must be serious because of the sort of signal degradation that occurs between the top of the organization and the bottom if you're not deeply serious and deeply serious about specific things. And I remember hearing about the importance of the result, the great purpose, you're there together, the work that it takes to get there, and you have to show yourself committed to the work. But just as equally, it's the people that do the work. So the leader has to show just how committed they are to the people. And then I loved hearing him talk about, and that impact has to be most strong in those people you're working most immediately with, because then they'll say, well, if my leader is this serious, is this 1000%, maybe I need to be with my people too. Yeah. And it was that very same depth of understanding of how leadership works across a large organization, and the signal values, and therefore what has to be true at different levels, that I know we've seen at all the great places, and that level of intentionality. So, you just gave the highest frame, but I want people to know that they can go into the book and go into your podcast and hear much more detail, and we'll hear a little bit more from you in a minute. So Gerald, let's turn to you, and you are yourself a serious leader. You have been a serious leader for a long time. You coach leaders to be serious leaders, and now in healthcare, thank goodness for those of us who are committed and our mission center on this industry. And you've recently been doing a lot of thinking about what it means to be a serious leader at this moment in healthcare. And can you sort of share your latest thinking on the framework that Katie has shared, and then translate it to what that means for you today?
Sure, and thank you. And before I go there, I just wanted to say, Ken, you talked about my career in manufacturing. I've essentially had two careers, one in manufacturing, leading plants within the automotive industry, and then the last 20 years or so in healthcare and coaching leaders. And when I think about uh, uh, being a serious leader and what that means to me today in healthcare is um, being committed. And I try to break it down to uh, really being patient centered and providing patient centered care. And so I try and coach leaders from that standpoint to act, think, and behave differently than they do today. And that's, as I connected to what Katie was talking about, it is really being committed to the vision um, and 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 the principles that they're trying to convey to the organization. Um, it sounds simple, but all people just don't really know how to do it. And I understand, there's no silver bullet, but there are learnings to be had to help you create the conditions where people can actually thrive and really, have this notion of patient-centered care.
Gerald, thanks so much for sharing that. And, I hear in what you're saying, and I want to check back that it's so easy to forget the fundamental purpose of why we're here, why the organization exists, sort of in the daily operation and in the stresses and strains, right? That we know this industry, and it's not unique, but others as well experience. And are you calling us back toward a deeper leadership that's anchored there in the patient? And are you having success in coaching leaders to reattach in a more fundamental, disciplined way to fundamental purpose?
Yes, I believe so. And I think, it's been more, they talk about being patient-centered, they being leaders. They'll talk about being patient centered, but really, are we really prioritizing patient centered care and making sure that they are putting the preferences and the needs of patients and those caring for patients really being top of mind and being really at the center of everything they're doing. And it's difficult for leaders because they're so embroiled in this, cost and everything, all the other noise that comes in, and it distracts them or takes them away from that deep purpose.
Mm.
It's a great jumping off point to talk in more detail about, okay, we all want to not be guilty of saying the words, but not building the system and the serious support to get there. So let's talk about what that looks like and give some examples of when it's happening, or maybe, when it's not happening, and some root cause thinking, so we can help our listeners think more deeply about it. Katie, I bet you have a story or two you'd like to share about being a serious leader and helping leaders with empathy improve their score, if you will, that they, of course, want to realize.
Absolutely. And there's so many examples. I want to highlight one that actually is going to be recording a podcast with, medical director who came with me to Japan on this recent trip, who's actually a value capture client and who's going to be speaking at the Lean Solutions Summit as well. And she and I were exploring some of the things that shifted for her, these ahas around what it meant to be a serious leader. And she said one aha was about how leaders should go to Gemba, the Gemba being the Japanese word for the place the work happens, not just to check on process and, see if people need help with problem solving and the status, but truly to check in with people. And this was an aha moment for her in seeing how a lot of these really serious Japanese, and by serious, I don't mean like stern serious, but really committed, passionate Japanese leaders were about going to the shop floor or the company floor and connecting with their people and asking about them. And this is something Mr. Yoshino highlighted to me a decade ago that was really an aha for me, that we don't just go to Gemba, we don't go to seed just to check on process, we check on people. So to be serious, we have to first and foremost start with the people, because it's the people who get the results. And of course, the results are so that we get those for our patients, if you're working in the healthcare system. But we need to have that human connection. So an aha for her was not just focus only on the process, which is important, but also checking in with the people. And so she's starting to bring in some more of those habits and behaviors when she's going to see, so that she's making that real genuine human connection. And so I'm really excited to see what shifts for her in the organization in that, because we get so focused again on the results and then the process to get the results, but the people are the ones who do the process. So that was a really big aha of how to become a serious leader. And then another healthcare organization, some senior executives I've been working with for several years, have been really focused on how to keep their community hospital system independent. And that is so important because they want to serve their community, their people. And so to align on that as the number one priority and be really clear about the community connection has been really tremendous for them. And having this long-term view. I have a calendar behind me that actually is from one of the companies I visit in Japan. It's called the 100-year calendar. And it's to have this longer-term view of one day is just one day. So how do we have this long-term view? How do we create organizations that are going to prosper and thrive for the long run for our communities and for our people as well? And so just some of those, just thinking, getting really clear on what is the true focus and the why, and then how do you support your people and really show up to demonstrate that you care, which is attention, right? So, because we need those results. But everyone I know who's gone into healthcare comes at it from a place of heart from the beginning. So how do we stay connected with that and get the results that we need at the same time?
Katie, I love those two examples, and I love how you tied them together. And again, it makes me think of the great places we've been around. Um, and our co-founder, Paul O'Neill, who was the CEO of Alcoa and safety leader, inspiration in healthcare, some of the greatest results anywhere across sectors. He would often talk about leaders need to think about how do you make sure this company is a great company 50 years from now, 100 years from now. And in other cultures, we're more used to thinking that way. But it changes your whole lens on what you build and how you build it. And that it is about the people and the culture, as you say, and that digging in. And you gave a great example from healthcare today, and you were kind enough to do it attached to somebody we've had the privilege of supporting and learning from. And Gerald, you're our vice president at the institution Katie is talking about. So coming off her example or examples, what would you add about again, putting the pieces together so that you can be fully patient-centered, purpose-centered, and quite successful in getting all of the results that leaders need at the same time?
So I spend a lot of time helping or coaching leaders to manage the complexity and where that is. Katie makes it sound really simple when you talk about going to where the work is done and engaging with the people that are actually doing the work. So you show that you actually care about them. But at the same time, it is really, I think about what makes it difficult for those leaders to do that. Those are time constraints and resource allocations and resistance to change and regulatory things that come up that all get in their way. And can we help leaders to overcome those barriers so they can do the work and set the conditions that they need to set so people can be successful?
Katie, Gerald's brought the reality of all the forces buffeting us, when we're in the leadership role, including today in healthcare. how in a way that puts a premium on the kind of behaviors we're talking about, right? So what reaction do you have and other stories that help illustrate not doing the right thing in a smooth, calm context, but in a quite turbulent one?
I have a great example. This came out of a reflection session from the same organization, the community-based healthcare system that I've been working with. I've done a few leadership retreats with them, and their executives have come to Japan with me. But it was a very, very powerful reflection a year later between some teachings around how to show up as a leader, not having all the answers and just telling people what to do. And this area director, nursing director, shared 1 year later how profoundly different her experience and her team's experience has been, because she has been trying to do what I call break the telling habit by really being clear on what are the things we need to achieve and then asking more questions and engaging her team in problem solving. And she shared how in this reflection session, how hard it was and how painful it felt for her, because she loved, just it felt easier for her. That's what she's used to, being very directive, telling people what to do. But she was really committed to practicing and trying a different leadership style. And she said just the impact over the last year has been tremendous. Her team's more engaged. They're actually collaborating better. She feels like they're solving more problems, being more patient-centric, actually getting things done for the patients. And she was just glowing. And she's like, it was so hard. I was like, when you told me all of this, I said, no, no, no. But I tried it, and just that shift has made. So sometimes it can feel like the gap is so big, but we can get a little bit better. So how do you, even in times of crisis, how do you slow down and maybe ask one or two more questions every week? Give a little bit more space. And over time that will build. And so not to see the gap as something so big that has to be overcome today, but again, that long-term view and just practicing and being committed and intentional about how you're going to show up as a leader, and know that it's not going to be perfect all the time, but that will grow over time, and then you'll see the impact.
Katie, I appreciate that point and that example, and Gerald again for raising the turbulence. And I think it makes me reflect back to a mentor who said, if you let your inbox and the chaos of your email determine what you're going to do in your day, you're dead, right? And it's what are you trying to create intentionally, through the people, to accomplish the work has to be what drives the organization. And then helping other healthcare leaders sort of realize that all of the craziness of the thousands of measures we're held accountable for and everything, they can be well-meaning, but they're all sort of fractals off that can only be accomplished by sort of creating that great operating system based on these serious leader principles of what are we trying to accomplish and what are the principles we're going to do it by and how are we going to show up, that creates the possibility to hit all those thousands of things at the same time. So I think that the craziness that you've rightly brought into this is a function of sort of if you succumb to the fractals versus create the engine that then can satisfy the fractals. And hopefully our regulators and others will catch on about that approach that's needed in healthcare. So you guys are inspiring me. Well, I know there are a million other stories that we could cite, and in the promise of this idea of serious leadership at this moment in healthcare, where leaders certainly feel serious challenge. Katie, and we thank you and Mr. Yoshino and those of you that your thought leaders, Brad and others, and today Gerald for helping us grab onto that and go deeper with it. But we also want to talk about an opportunity coming up in late September. The 2024 Lean Solutions Summit with our friend Patrick Adams and Lean Solutions occurring up in Michigan. Katie, you're one of the keynoters, and Gerald Value Capture is helping to sponsor the healthcare stream. So, Katie, let me turn to you first. Why are you excited? Why did you say yes to being such a deep participant in this conference, and why should serious leaders who have a lot to do plan to come and spend a few days with us in Michigan?
So Patrick Adams, a great lean thinker, actually wrote the foreword to his book, invited me to be part of the summit. And the topic is just so up my alley. It's about the power of continuous learning. And, that's a subtitle of my book, Learning to Lead, Leading to Learn, Lessons from Toyota Leader Isao Yoshino on a Lifetime of Continuous Learning, because that's what it's really all about. I'm excited to be pulling in the keynote that I did for the Shingo Institute recently. There'll be a Devo-inspired session about the real meaning of Kaizen and how we can really pull that in to our leadership about continuous improvement and being serious. Also, I'm going to be doing a panel discussion hosted with Value Capture here. So that's going to be really great with some of the healthcare leaders I was just talking about. And I'm going to be teaching a workshop about how to break the telling habit. So if you're curious about how to get started on how to start asking more and better questions and get out of that habit of telling, we're going to have a session on that. But more than anything, I'm really just thrilled by the number of amazing operational leaders from healthcare and other industries, as well as thought leaders who are going to be there mixing together, Jeff Leiker, Mike Rother, so many more. And just the opportunity to learn and share together in a really intimate, interactive way. So it's like definitely, I'm super excited to not only be part of the event, but just be engaging with everyone who's going to be there as well. And I have a discount code too. So use hashtag Katie Anderson for 40% off.
Wow. So not only is Katie sharing the excitement and all of the good substance stuff and practical chances, but she's throwing in discount codes and Devo, Gerald. So
yeah, I have a hat my kid made.
On top of that, Gerald, what would you add about the summit and why are you excited about it? Why are we devoting ourselves and our efforts to helping this be successful? But more importantly than that, why should a healthcare leader spend the days with us?
Yeah, so Patrick asked us if we would really sponsor the healthcare track, which we are doing. And it's exciting. It's an opportunity to learn best practices in the industry, and for lean practitioners and leaders to come together and learn and share with one another. So we're excited, and hope that you'll come and join us the 24th, I believe, through the 27th of September to be in West Michigan. Yeah. And it also gives me an opportunity to go back home to my my roots, and that's Michigan. So
wonderful. I want to highlight too, Ken, one of the you're going back to something you mentioned earlier is that, we get so busy, especially healthcare leaders and executives are under so much pressure in the day-to-day work that there isn't time to sort of rise up and have that sort of reflective space. And so a container like going to a summit like this or joining me in Japan for one of my executive study trips gives that space to actually look holistically, reflect, learn, share together, but also to just not be in that reactive mode. And so we have to sort of have those moments where we can break out of that cycle so that you can come back re-energized, have some new perspective and some new behaviors that you're going to practice. Otherwise, you just get stuck in that, you can get stuck in that really reactive wheel. So that's what's some of the power of continuous learning and taking a step away from the day-to-day as well.
Katie, I'm glad you raised that, and it is so true. And we've actually had a lot of leaders that we work with talk about how these challenging years of COVID and responding to COVID, and now the financial hangover of the consequences has left them more isolated and their networks narrower and with less time to do this kind of reflection. And most leaders are extremely capable, and it turns out that just this time to reflect and learn from each other is just so important to restoring their power and providing, just that new angle that can unlock. So if you're listening to this and you're feeling some of that, that is a huge reason to join that Katie has just given, and that a lot of your peers are sharing as the reasons that they're going as well. I'll just add, I was honored to speak at the first of the summits last year, I think, and certainly found it to be both a practical and deeply thought-provoking exchange of ideas at multiple levels in a beautiful setting. And I'm sure that people who attend this year will as well. So thank you very much. For more information, Katie, you've already shared your website once. Tell people again how to get more information directly from you, which includes not just the summit code, but also all of the wisdom and support services that you make available.
Great. Thanks, Ken. So you can find me on my website, which is kbjanderson.com. Also connect with me on LinkedIn. And of course, you can discover more about my podcast, Chain of Learning, and my book, Learning to Lead, Leading to Learn, on those sites as well. And then remember, if you want that 40% discount for the conference, use hashtag Katie Anderson. So that'll be great to defray some of the costs. And if that's one of the barriers to you coming, don't let it be.
All right. And Gerald, how, for people that want to connect with you and connect with Value Capture and all the resources, rich resources and people, training, advisory support, the things that they can access depending on their needs, how do they find out more about you and Value Capture?
So I would tell people to go to valuecapturellc.com and go on our website. We are promoting the summit on our website. And then my personal email would be gharris@valuecapturellc.com.
All right.
And can I add, can I add one more thing? I forgot to mention, I'm actively enrolling for my next open Japan study tour. My November program's fully sold out, but I have another trip in May. I love bringing cohorts of leaders or individual leaders. So you can learn about that on my website, kbjanderson.com/Japan trip. So, and reach out.
And again, you can sense our strong endorsement of the things that Katie does. Members of our team with leaders that we are coaching have gone on this tour very recently and in previous years as well, and highly recommend it. So thank you, Katie, for providing that service to the community. One last thing before we end, I'll say is that if you're a healthcare leader or a leader in general, and you're not sure about lean, or if you're a lean person, if you've heard things, I would encourage you not to be put off by the label or stay away, because what you'll in fact find is people who are really serious about creating great principle-driven organizations centered on their people and how to create and sustain great operations. And that's what it's about. And I think you'll be pleasantly surprised if you can get past any labels or thoughts that you might have in that regard. So with that, hope you've enjoyed this episode of Habitual Excellence. I know I certainly have, with Katie Anderson and Gerald Harris as our guests. If you haven't already, give us a like, and remember to subscribe to the podcast on your favorite podcasting platform. Check out our website, as Gerald said, check out Katie's website. And more importantly than that, share learnings with all of us, because we know everybody listening here is making really important things happen through their leadership and their supportive leaders. And it's that community of learning that we treasure, because that's what's going to make the difference over the 50 and 100-year timeframes that Katie has alluded to earlier. So thank you all for being here.
Thank you, Ken.
Thanks, Ken. Thanks, Gerald.
Thanks for listening to Habitual Excellence, presented by Value Capture. We hope you'll subscribe to the podcast, and please also rate and review it in your favorite podcast directory or app. To learn more about Value Capture and how we can help your organization on this journey to habitual excellence, visit our website at www.valuecapturellc.com.